Another story that we're following, 117 employees at Houston Methodist Hospital are suing the hospital over a law that requires them to receive the COVID-19 vaccine. Now, some employees are claiming that the hospital is turning them into vaccine guinea pigs and breaking the law by making the shot mandatory. Joining us now to discuss is healthcare analyst and author of The Cure, Seth Denson. Seth, thank you very much for joining us. What do you think about this? Do you think that healthcare employees, specifically in a hospital setting, should be required to get the vaccine?
Well, I think that this certainly goes back to an employer's allowance to make certain requirements. There's been precedents before, a long-standing precedents, that employers specifically can make certain requirements of vaccines. As a matter of fact, just recently, both the EEOC and OSHA came out and said that employers could do this as guidance. But here's the reality. There's not federal law on this. There is state law, and specifically in Texas, which is an at-will employment state, the government provides protections for employers for making certain mandates so long as they allow for employees to get certain reasonable accommodations for things like religious reasons or even disabilities.
So their argument, some of them, is that this is an emergency use vaccine. So it hasn't gone through the regular process. So there's added risk in this. And every day they're putting their lives on the line anyway. What's your response to that argument?
Well, I think there's certain merit there. I mean, this is emergency use authorization. This is not something like a normal vaccine would go through its normal protocols. mRNA technology, though, has been around for some time. So again, there's personal thought on this, and then there's professional thought. My personal thought is I've gotten the vaccine. I got guidance from my doctor to do so, and I followed that guidance. But I can certainly understand why some people would be reluctant to do so. Again, though, at an at-will state of employment, that's their right to take that job or not. And it's the employer's right to mandate it. That being said, under OSHA, again, if we want to get technical, it requires that an employer provide a safe workplace environment, and it requires under HIPAA that they not disclose who has and hasn't gotten it. So let's say an employer says, you get a vaccine and wear a mask, right? Well, now, if you're making somebody wear a mask because they didn't get the vaccine, are you now disclosing that they have or haven't gotten the vaccine? There's a lot of gray area in this. In the employment world, we like black and white. There's just not a lot of it here.
Yeah, they have until June 7th, I think, to get the vaccine, or they faced being suspended or eventually terminated from the HR letter that was sent out to the different employees. How do you feel once the vaccine, if and when it is no longer emergency authorization, that it becomes full FDA approval?
Yeah, that certainly changes the game, Heather, and that's a good point. But the reality is right now, Pfizer's the only one that's actually filed for biologics approval. So neither Johnson & Johnson nor Moderna have. So we're likely a long way away from that. But once it is approved, I think that emergency authorization use gets thrown out the window.
So you're not a lawyer, I don't think, but
No,
this will
I just play one on TV, Bob.
Yes. So it sounds like there's some interesting legal issues here.
Yeah, absolutely. And certainly this is going to get litigated time and again. There's somewhere near 1,000, I think, lawsuits right now pending in the courts of employers getting sued. There's not a lot of liability protections out there on COVID-19 for them. At the federal level, there is at some state levels. But nonetheless, this is going to get litigated many, many times going forward.
Yeah, we touched on this a little bit with Dick Morris when we were speaking with him, and his wife recently had a stroke and is in the hospital. And he said, you know, as someone dealing with a patient in a hospital setting, his wife, he was very thankful that everyone at the hospital where she's being treated were required to get the vaccine. So there's that perspective as well.
Yeah, and it's also important to note, Heather, that at this specific hospital in Houston, Methodist Hospital, I think something like 99% of staff have already been vaccinated. So this is a very small percentage that are bringing this lawsuit. But nonetheless, if I'm going into that hospital, given the expansion of COVID and especially the incubation of hospitals, I certainly would want the folks treating me to have been vaccinated.
All right, Seth, what's that background? Where are you?
I'm in Dallas, Bob.
That's what I thought. Okay, very good. Texas.
Absolutely. It's beautiful this time of year.
Thank you very much. That just says it all. I mean.